In this segment, we're going to do a lateral recumbent lumbar high velocity, low amplitude technique to an L4 that is type 2. So this could be a flexion or extension type 2 dysfunction. And how we do this is we find our dysfunctional segment and we get on the spinous process of the upper and lower. So if it's L4, I find the L4 spinous process as it relates to L5. I flex and extend the hips until I feel L4 and 5 separate with hip flexion and then approximate with hip extension. And then depending on whether it's a flexion dysfunction with an extension barrier or an extension dysfunction with a flexion barrier, I'm looking for the feather edge of whatever barrier exists. Now, as we said in muscle energy, with type 2 dysfunctions with muscle energy and HVLA, a lot of people believe with the type 2, you should keep the legs together. Because if I let the leg come off, it side bends the patient on the upper away when you really need to be approximating here at the upper. However, as I said in the muscle energy video, I as a physician can put this external force through the system and the patient has more motion with the leg off the table, and therefore I think I can get better positioning with the leg off, and you can try either way. But whatever the case may be, as you're doing this, don't lose contact with your segment because you might have to change some little flexion extension component. Now, with this, I take my upper hand, cephalad hand, lock the antecubital fossa, forearm in the anterior pec area. This hand palpates my intersegmental space between 4 and 5. I can kind of get on the transverse processes if you want a little bit. Put my forearm across that greater trochanter, making sure I'm not on the piriformis muscle or the sciatic nerve over here, that I'm actually over the posterior aspect of the trochanter, and make sure that I have my rotation right down to the level I need. And to do this properly, you don't want to get the upper back on the table flat, so what I usually do is just sort of get an idea that I'm there and then pull this pelvis forward towards me. Then I take my hand up here on the arm and I push that back to get the fine rotational barrier, and you can see I don't have to move his shoulder that far. Then my forearms are going to approximate the shoulder and the pelvis. So we talked about type 2 together, and the muscle energy is the same thing here. So now I have him right at his barriers, and I might leave one barrier just a little free so that the patient doesn't guard too much, try to fight back. Make sure the patient's comfortable. Have the patient take a deep breath, let it out, just kind of readjust a little bit, make sure you have it, the patient's not guarding. Then on the next deep breath, let it out, and as they let it out, just take your hands in the direction that they're pointing, this going back, this coming back towards me, and give a thrust in that direction. And the thrust is with the forearms, maybe a little bit here, but mostly in this direction like this. The hand here is just monitoring, so I'm not pulling anything here. Okay? So this would be type 2. So as I do this, take a deep breath, let it out. The forearms come together, but rotate in the other direction. So it's in this direction as well as this direction. And this is a little bit more difficult. This is harder to learn. Now, as you come up and work higher into the lumbar spine, what you're going to do is approximate all the facets below that by extending, which is a little counterintuitive. And as I extend, I approximate this facet and then this facet. So it segmentalizes it from the bottom up and then leaves this to be pulled off the upper one. The other thing is as you go higher in the lumbar spine and you get involved in some psoas, extension type 2 dysfunctions, L1, L2, sometimes you can take this arm here and not just pull it straight towards you to help rotate the patient to get extra rotation, but actually move the patient's arm this way, pull upwards, and you'll get a gapping side bending on the bottom, which then causes the approximation on the top for these type 2s. So there are all these little nuances you can do. We'll talk about this in the laboratory sessions as well. So we had an L4, flexed or extended type 2, side bent right, rotated right, HVLA.